Hi, it's Dr. Noel Williams, Optimal Health Associates, July 7th, 2021. COVID update and other things. Sorry about the slow-mo miscue on me. I could blame it on Kim, but it was really me. I said a lot of really important things in that video, but I can't remember what any of them were. So we're going to keep on going. So what's the latest? Well, I'm going to rehash some of that. Well, there's concerns about some of the variants. Again, the Delta variant is not important unless you're not vaccinated or you haven't been infected. If you're vaccinated, you have functional immunity of over 99.9%. If you've been infected, it's probably about the same. So it's not anything to be concerned about if you're in those two groups. Now, if you're someone who hasn't been vaccinated, you do have to have more concern about it. And if you're not going to get vaccinated, I would strongly encourage you to be on your zinc, your multivitamin, your vitamin D, your fish oil, your vitamin C, elderberry, all the things we've gone over for well over a year and a half now, because you are at risk for getting it. If we look at the 10,000 people who died in the United States, in June, 99.2% of them were unvaccinated. Now, there was 0.8% of the group were vaccinated people. So yes, there is a teeny risk, but you have to remember something about vaccination, and I think this is really important. There's always going to be a small group who are allergic, who it just doesn't work on at all. And if you're in that group, the group to be concerned about is if you're on chemotherapy for cancer, chemotherapy, formal biologic chemotherapy for rheumatologic disease or ulcerative colitis, and you get vaccinated, make sure you get your antibody levels checked so you can prove you have a level of immunity from it. There are definitely case reports of people on those classes of medicines who have not responded to the vaccine because their immune systems are turned off because of the chemotherapy. So just something to be aware of. Likewise, about 5% of the population is not going to respond to vaccines in general, so that makes sense. So we just have to always remember there's a small risk. But I mean, when you talk about Fauci, he discussed that the effectiveness of the vaccine was over 99% this weekend, but he then went on to say it wasn't 100%, so we needed to still be terrified, which again is hogwash or some other phrase. But the key thing is safetyism doesn't exist in anything. There's the concept that the vaccine would be 100% effective is nonsense. There's no such thing in vaccinations. Likewise, the idea that it's 100% safe, which they seem to act like too, is hogwash. It's not. There's risks associated with the intervention, which is why I still don't think there's any proven data for use in children or those much under 21. So again, people can get sick with COVID at that age. It's rare, but ultimately the risk of death is teeny tiny. There's 850 reported cardiac events in people under 30 from the vaccine, and it's very specific within 5 days after the vaccine, either the first or second dose, and it's preponderant. That data is in people under 21, and again, if there's 850 people reported so far, there's 10,000. That's 10 times that number have events, but they just don't come in because they get sick and then they blow it off or their parents weren't there or whatever. And so it's definitely causing some heart stuff. That's my opinion looking at the data because it's too focused. It's not a temporal relationship. It's very specific to within 3 to 5 days of the vaccine is what we're talking about. So again, I think we need to wait on kids. That puts me in disagreement with just about everyone, but I don't care. That's my opinion. We're allowed to still have opinions in this country. Believe it or not, you young people, if there's any younger people listening, like people under 50, you're allowed to disagree with each other civilly, and it doesn't make you a racist or a bigot or anything else. You're just allowed to disagree. That's what the country was founded on, civil discourse and disagreeing and then having the majority rule. But we're getting messed up. I won't go into that. So that's the bottom line on the Delta. The newer variant that they're talking about is the Lambda. Probably going to be about the same story. There's one paper out on the Lambda which showed that there was less immunity with the vaccinated, but it was the Russian vaccine. The Russian vaccine's terrible. We already knew that. That's not a surprise. So until we see something different with the Lambda variant with people who have been vaccinated or have prior infections, I wouldn't worry about it. Because again, every single thing is the constant horror of COVID, and we can't let go of it. And just to be clear, once you're vaccinated, I would never wear a mask. I'll never wear a mask again unless I'm being polite at a building. It's idiotic to wear a mask. The data shows that if you're outside, the sunlight's going to kill it. Ultraviolet light is what they use to sterilize hospital rooms. What's the official form of ultraviolet light of all time? Sunlight, 7 minutes, you kill the COVID. So the worst thing you can do is wear a mask outside. If you're vaccinated, there's no reason to wear a mask inside either, okay? But if you want to, you can, but the masks are not that protective. What they were doing was inhibiting the spread of viral particles from someone who is infected when they're coughing. The data doesn't show that they really have improved anything other than that. Now that we know that, we should act on it. So just keep that in mind too. So the Lambda variant will be the new scare tactic to think about. Then moving on, the COVID will come back up a little bit, kind of like the seasonal flu, much more so like that in the winter, because that's when it's going to be more around. So again, we really do want to focus at all times. I think this has taught us anything nutrition matters. Who gets COVID and gets really sick predominantly? Poorly nourished, obese people with bad medical histories, but other people who are at risk are poorly nourished people, people with low vitamin D, people with low testosterone, people with low vitamin levels, because your immune system doesn't function well. And so if you're on chemotherapies chronically or things that affect your immune function, make sure you're taking your supplements and make sure you're organized for next winter, because it also is going to protect you against the flu, which segues into, would you ever get the flu vaccine? Not if you read the data, but that's me. Again, I'm a science guy. Unlike Dr. Fauci, who says he's a science guy, because he said this last weekend, that if you disagree with him, you're essentially disagreeing with science. He's not referenced any science so far in a year and a half. So but that's here nor there. I know he's omnipotent to many of people, but it's just, again, he's been wrong about everything. There was just a meta-analysis published on Ivermectin, which we should be really thinking about. Again, for those of you who get exposed or infected, we treated more than 300 people with Ivermectin successfully with really scant events of any type. I don't even know if we had a hospitalization or two. We maybe had a hospitalization or a couple with the Ivermectin. We only had about 6 or 7 total with Ivermectin or Plaquenil, and no deaths out of 500 patients. So again, pretty sterling data on that anecdotally, but if you look at the meta-analysis that was just published looking at 15 different trials, I've mentioned this already, I think, in the last few weeks, that it was about an 86% prophylactic rate and a 68% reduction in death across all these different analyses. And one of the things I read was why that meta-analysis didn't count was they didn't have enough negative data, meaning like there wasn't any bad outcomes. So it can't be true. Ivermectin is freaking harmless, okay? It's harmless. It's harmless. These dog dewormers, which we use for all different things, are harmless, essentially. So they're safer than taking aspirin. They're safer than taking Tylenol. But be that as it may, but that's the other thing, if you're not on anything and you get exposed or you haven't been vaccinated or infected, call your doctor, see if you can get Ivermectin. I think there's going to be a little pulse of, oh good, the microphone wasn't plugged in. Should I start all over? Anyway, I won't start all over. I hope you could hear me, but Kim, you're blowing it.
Hey, we're out of practice.
Okay, so and I just a story like that. I had someone who got infected, and then I treated the whole family and that person, but they were not in Oklahoma. And when I called in the scripts to the pharmacist very nicely called me back and said, are you sure you want to prescribe it this way? And it was very funny to me. He's very nice. And I said, yes, it's just don't worry about it. Just do it. But he had never had anyone call in Ivermectin. And he was the head pharmacist at a CVS, not in Oklahoma, but he'd never had someone call in Ivermectin to his pharmacy in a large metropolitan area in a busy suburb. And I just thought, these these poor bastards. I mean, there isn't a doctor within a community of 7, 8, 9 million people who's called that pharmacy with ivermectin. How sad. Way to go, federal government. But so that's the end of that story. Anything else, Kim? I can't really think of it. Stay positive. The heat's here. I am going to do an ozonation talk eventually. I'll do it right now. Anyway, but I won't do it with this video. So anyway, take care. God bless. And I'll update you as things happen. Bye.